Hello everyone, myself Dr. Namrata Vitlani. So in this video we are going to discuss and solve an ABG. So here is an example of a patient. The patient presented to us with history of dyspnea at rest and decreased urine output since 24 hours. So patient who is morbidly obese, the weight was around more than 110 kg. So this is the ABG on admission. In the ABG we can see the parameters that pH is 7.16, PCO2 73, bicarb is 26, sodium is 133, chloride is 99, bicarb is 26. On further evaluation, in the ABG and other reports, the creatinine value it was 3.02 and the albumin level is 4.26. So we can see that here first we have to decide which is the disorder, whether it is pH is normal or not. So pH is 7.16, which is on the lower side. So we can say that it is the patient is having acidosis. Now if the pH and PCO2 are in the same direction, patient is having the metabolic acidosis, and pH and PCO2 are in the opposite direction, then it is the respiratory acidosis. Here we can see that the PCO2 is elevated, which is 73, and the pH is 7.16, which is lower side. So patient is having respiratory acidosis. On the further evaluation, we investigated that the patient was symptomatic since long. Patient was having daytime sleepiness and breathlessness and bilateral pedal edema since many days, and the symptoms were even more severe since 1 month, and they were the patient was hypoxic and having respiratory distress since 3 to 4 days. So from the history we can say that the nature of the disorder is chronic. So it is chronic respiratory acidosis. So we decided the primary disorder, that it is the chronic respiratory acidosis based on the history and the ABG findings. Now once we diagnose the respiratory acidosis, we have to look for the compensation. When there is a respiratory acidosis, their kidney starts the metabolic compensation. So we will calculate the expected bicarb based on this formula. So if we put all the parameters in the formula, say for the expected bicarb 24 plus 4 and PCO2 minus 40 upon 10. So PCO2 is 73 and minus 40, so what we get is the value is the 37. So expected bicarb value is 37, but what we have got in the ABG is 26. So it is lower than the expected. So other disorder, that is the metabolic acidosis, it is also present, which might be due to the presence of renal failure, as patient has also elevated creatinine values AKI. So the disorder, it might be related to the renal failure AKI. So chronic respiratory acidosis with metabolic acidosis it present. Now whenever the patient is having metabolic acidosis, we also do look for the anion gap. So anion gap in this patient, if we calculate by the formula, serum albumin level is normal, so sodium minus chloride plus bicarb, so anion gap is 8, so which is normal. So final conclusion is this patient is having chronic respiratory acidosis due to the obstructive sleep apnea and inadequate metabolic compensation due to the renal failure. So patient also had the metabolic acidosis. Thank you.